Today is this is the I'm talking about the 10th week. Next week is the 10th week. Well, it starts tomorrow. I got to get this thing in. Today we're talking about cognitive behavioral therapy. Cognitive behavioral therapy was developed by a guy by the name of Albert Ellis. He's from Pittsburgh. He came up with a therapy technique because because he was trying to control his own life. Um, he had a difficult time. He was backwards as a child. He stuttered. He had diabetes. He had all kinds of interesting problems. And because of that, he had to train himself to do things. He had to train himself because he was so backward and because he stuttered. He had to force himself to do things. And when he was able to do that, he realized, I could train other people to do this as well. And that's where rational emotive therapy came from. It started out as rational emotive therapy. He did things like when he was young, he had a problem, with the stuttering and whatnot. And he would practice talking to people by going to the park in Pittsburgh and asking women to go out with him. And day after day, they would say, no, 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 no. And it lasted for 100 days. He didn't get anybody that was willing to go out with him. But then on that 100th day, a lady agreed to go out with him. And he married her, and he stayed married to her for the rest of his life. Okay, but Alice got in trouble, and the reason he got in trouble was he got in trouble for two reasons. One of the reasons was because with his therapy, he would sell people his books, and he would tell them, "Well, if you need help, you need to buy my book," and they thought that that was too commercial. Uh, so the APA kind of poo-pooed that. But he really hit the skids when he started having sex with some of his clients. And the reason he was having sex with some of his clients was because they were saying, I'm unattractive, I can't find anybody that loves me, I'm unlovable. And of course, he was using it as therapy. And they thought that that was fairly unethical. So for the longest time, cognitive CBT or cognitive therapy was understood, and it was they wanted to use it, but they didn't like Ellis. And then Aaron Beck came along, and Aaron Beck said, this is a good type of therapy. Why don't I adjust it a little bit? Ellis was very directive. He ordered people to do things. He gave them a lot of homework, and but he told them they had to do it. But Beck was a little bit softer. He was softer and gentler. So for the longest time, it was Beck, or it was Ellis until the 1970s, and then all of a sudden, nobody talked about Ellis anymore. He was persona non grata, and Beck was took over CBT, or actually took over cognitive therapy. Eventually, everybody forgave Ellis for what he did. The fact he commercialized psychology, and the fact that he was being unethical with some of his clients. And they put the two together, and what they came up with was cognitive behavioral therapy. My cat got up on my lap, and now I got cat hair everywhere. Anyway, okay, so let's go ahead and get started with this. We're going to talk about Ellis first. Actually, Ellis is the one that developed it, so there's really no reason not to talk about Ellis. If you find sex a taboo subject, then you can pretend that we're talking about Beck. But he's the one that actually developed it. And Beck admitted that. And there's the two of them together. This is the only picture that we have of Beck and Ellis together. And the reason is because this is just before both of them died. Ellis died first, and then Beck died about a year later. but they were at an APA conference, and they agreed to see each other. Ellis was really upset that Beck took over his therapy technique, um, and eventually, of course, he forgave him. And this picture was taken just before both of them died. They're the two fathers of cognitive behavioral therapy. I really, I think Beck stole the therapy from Ellis, but the APA for the longest time wouldn't admit that Ellis even existed. So there you go, the two fathers of cognitive behavioral therapy. When he first started, Ellis called his therapy rational emotive therapy, and then when he kind of merged it with what Beck was doing, he called it rational emotive behavioral therapy. And now, of course, we don't talk about rational emotive behavioral therapy. We talk about CBT, cognitive behavioral therapy. Both individuals developed similar theories that were based on the interaction between cognitions, your thoughts, your emotions, and how you act. That's Ellis when he was young, when he was still a stutterer. The assumption behind rational emotive behavioral therapy, developed by Ellis, is that people contribute to their own psychological problems as well as to specific symptoms by the way they interpret events and situations. REBT is based on the assumption that a reorganization of its self-statements will result in corresponding reorganization of one's behavior. While there may be 20 different cognitive therapies, they tend to have four things in common: a collaborative relationship between client and therapist, the premise that psychological distress is largely a function of disturbances in cognitive processes, a focus on changing cognitions to produce desired changes in effect and behavior, a generally time-limited and educational treatment focusing on specific structured target problems. And that was one of the positive things about all the cognitive therapies, is that it is limited. They limit the number of times that you need to come and see them. And that is really positive, especially since most of the therapists, especially back in the 60s and 70s, started out as psychoanalysts, where you would do therapy for a year or 2 years. Of course, these are all limited by, I'll only need to see you 10 or 11 times. That's the way cognitive therapy tends to work. REBT is based on the assumption that human beings are born with the potential for both rational or straight thinking and irrational or crooked thinking. Humans have the potential to self-preservation, happiness, thinking, and verbalizing, loving communion with others, and growth and self-actualization. However, they often do not live up to their potential through self-destruction, avoidance of thought, procrastination, endless repetition of mistakes, superstition, intolerance, perfectionism, and self-blame, and avoidance of actualizing growth potentials. Ellis feels that individuals are self-talking, self-evaluating, and self-sustaining. They begin having problems when they mistake simple preferences as dire needs. Ellis feels that we originally learn irrational beliefs from significant others during childhood. We add to these irrational beliefs by creating irrational dogmas and superstitions ourselves. We actively reinstall self-defeating beliefs by processes of auto-suggestion and self-repetition, and by behaving as if they are useful. Thus, it is the repetition of the individual rather than the parents that lead to irrational beliefs and dysfunctional attitudes. We can change our thoughts anytime we want. So if we're getting bad information from our parents, we're getting bad information from society, we can change our thoughts anytime we want. But we don't. We accept what we are being told. Bart was a little pudgy as a child and had a slight lisp. Because he was a little soft, he chose not to participate in sports, though he was a natural. Because of his lisp, he refused to talk in class and was considered a loner. He was a whiz in most of his classes, and when people asked him to help them, he seemed to have a gift for understanding why they were having so much trouble. He wanted to be a teacher but couldn't get past speech class. He tried, but he always told himself, I can't do this. I sound stupid. He grew to be 6 foot 10 inches tall and was fairly graceful, but when people asked him to play, he just shook his head. REBT contends that we have no control over what other people feel. Thus, being depressed, anxious, hurt, or angry because someone doesn't show us the feelings we want is illogical. We must accept ourselves despite our imperfections and stop blaming ourselves or others for something that we have no real control over. We have a strong tendency to escalate our desires and preferences into dogmatic shoulds, oughts, and musts, demands and commands. Such demands create disruptive feelings and dysfunctional behaviors. At times, we internalize irrational ideas that may become self-defeating. Some irrational beliefs include I must have love and approval from all significant people in my life. I must perform important tasks competently and perfectly well. Because I strongly desire that people treat me considerately and fairly, they absolutely must do so. If I don't get what I want, it's terrible and I can't stand it. It is easier to avoid facing life's difficulties and responsibilities than to undertake more rewarding forms of self-discipline. By trying to maintain such beliefs, we make it almost impossible to achieve or maintain good mental health. One of the central themes of RBT theory and practice is the ABC theory of personality. A equals an activating event, behavior, or attitude of an individual. C equals the emotional and behavioral consequences or reaction of the individual. This reaction can be either healthy or unhealthy. And B equals the person's belief about A. A does not cause C. In other words, the way we feel or behave is not controlled by events. Albert divorced Betty and married Carla. Betty became depressed from the incident and went to see a therapist. The therapist convinced Betty that it wasn't the divorce that depressed her. It was the belief that she was being rejected and had failed in her marriage that depressed her. Betty admitted that Albert was lazy and not worth the oxygen he breathed. She learned not to blame herself for others' decisions. Ellis trains clients to challenge their irrational belief system through scientific method. Thus, the D stands for disputing, a process that has 3 components: detecting, debating, and discriminating. First, clients must learn to detect their irrational beliefs, especially their absolutistic shoulds and musts. The client then debates their dysfunctional beliefs by learning to empirically question and argue acts and beliefs. Finally, the client learns to discriminate between irrational self-defeating beliefs and rational self-helping beliefs. Eventually, by disputing and discriminating between our beliefs, the client is able to minimize their irrational beliefs and hopefully arrive at an E, or effective philosophy. An effective philosophy is basically a philosophy that replaces unhealthy thoughts with healthy ones. If we are successful at this, we can create F, a new set of feelings. Philosophical restructuring changes our dysfunctional personality by fully acknowledging that we are largely responsible for creating our own emotional problems, accepting the notion that we have the ability to change these disturbances significantly, recognizing that our emotional problems largely stem from irrational beliefs, clearly understanding these beliefs, seeing the value of disputing such self-defeating beliefs, accepting the fact that we expect to change, and we'd better work hard in emotive and behavioral ways to counteract our beliefs and the dysfunctional feelings and actions that follow. Practicing REBT methods of uprooting or changing disturbed consequences for the rest of our life. The main goal of REBT is to minimize emotional disturbances and self-defeating behaviors by acquiring a more realistic and workable philosophy of life. Another goal is to reduce the tendency to blame ourselves or others for what goes wrong in our lives and to learn ways to deal with future difficulties. The therapist will help the client examine the basic values that they hold that keeps them disturbed. The first step is to show that they have incorporated many irrational beliefs. The client learns to separate their rational beliefs from their irrational ones. The second step is to demonstrate that clients are keeping their emotional disturbances active by continuing to think illogically. Because clients keep re-indoctrinating themselves, they are largely responsible for their own neuroses. The third step is to get beyond mere recognition of irrational thoughts by helping clients modify their thinking and abandon their irrational ideas. The therapist assists clients in understanding the vicious cycle of the self-blaming process. The fourth step in the therapeutic process is to challenge the clients to develop a rational philosophy of life so that in the future they can avoid becoming the victim of irrational beliefs. Because REBT is essentially a cognitive and directed behavioral process, it often minimizes the intense relationship between the therapist and client. The therapist mainly employs a persuasive methodology that emphasizes education. And I'm using education here. Remember, Ellis got in trouble because he kept selling his books. And people would come in to see him and he'd say, the first thing you need to do is read my book. Here, I'll sell it to you for 25 bucks. The therapist takes the mystery out of the therapeutic process, teaching clients about the cognitive hypothesis of disturbance and showing how irrational beliefs lead to negative consequences. When clients understand that certain irrational beliefs lead to dysfunctional emotions and behaviors, the therapist challenges clients to examine why they are clinging to the old misconceptions instead of letting go of them. What the REBT practitioner does, they encourage clients to discover a few basic irrational ideas that motivate much disturbed behavior. They challenge clients to validate their ideas, demonstrate to clients the illogical nature of their thinking. They use humor to confront the irrationality of their clients' thinking. They use logical analysis to minimize these irrational beliefs. They show how these beliefs are inoperative and how they will lead to future emotional and behavioral disturbances. What the REBT practitioner does, they explain how these ideas can be replaced with rational ideas that are empirically grounded. They teach clients how to apply the scientific approach to thinking so that they can observe and minimize present or future irrational ideas and illogical deductions that foster self-destructive ways of feeling and behaving. They use several cognitive, emotive, and behavioral methods to help clients work directly on their feelings and to act against their disturbances. Once clients begin to accept that their beliefs are the primary cause of their emotions and behaviors, they are able to participate effectively in the cognitive restructuring process. The client's role in REBT is that of learner. Psychotherapy is viewed as a re-educative process whereby the client learns how to apply logical thought to problem solving and emotional change. Re-education. The therapeutic process focuses on the client's experience in the present. The emphasis is on the here and now, experiences and the client's present ability to change their patterns of thinking and emoting that they constructed earlier. The therapist does not deal with the past nor make connections between what was and what is. Questions of why, what, and how they acquired their irrational philosophy is of secondary importance. Clients are expected to actively work outside the therapy sessions. Homework is carefully designed and agreed on and is aimed at getting clients to carry out positive actions that induce emotional and attitudinal change. These assignments are checked in later sessions, and clients learn effective ways to dispute self-defeating thinking. Toward the end of their therapy, clients review their progress, make plans, and identify strategies for dealing with continuing or potential problems. Therapists show their full acceptance by refusing to evaluate their clients as persons, while at the same time being willing to honestly confront clients' nonsensical thinking and self-destructive behaviors. REBT does not put a premium on personal warmth and empathic understanding. Too much warmth and understanding can be counterproductive, fostering a sense of dependence for approval from the therapist. REBT therapists are often open and direct in disclosing their own beliefs and values. Some are willing to share their own imperfections as ways of disputing clients' unrealistic ideas of them. REBT therapists are multimodal and integrative. They use a variety of cognitive, affective, and behavioral techniques, tailoring them to individual clients. REBT practitioners usually incorporate a forceful cognitive methodology in the therapeutic process. They demonstrate to clients in a quick and direct manner what it is that they are continuing to tell themselves. Then they teach clients how to deal with these self-statements so that they no longer believe them, encouraging them to acquire a philosophy based on reality. The most common cognitive method of REBT consists of the therapist actively disputing the client's irrational beliefs and teaching them how to do this, challenging on their own. Clients go over a particular must, should, or ought until they no longer hold the irrational belief, or at least until it is diminished in strength. REBT clients are expected to make lists of their problems, look for absolutistic beliefs, and dispute these beliefs. Homework assignments are a way of tracking down the absolutist shoulds and musts that are part of their internalized self-messages. Part of the homework is applying the ABC theory to many of the problems that clients encounter in daily life. The REBT therapist actually teaches the client how to think differently or models for them as opposed to the other forms of cognitive behavior therapy. In carrying out homework in REBT, clients are encouraged to put themselves in risk-taking situations that will allow them to challenge their self-limiting beliefs. A client with a talent for acting but fear of appearing before an audience might appear in a stage play, the client is instructed to replace negative self-statements such as, "I will fail," "I will look foolish," or "no one will like me" with more positive messages. "Even if I do behave foolishly at times, this does not make me a foolish person. I will do the best I can. It's nice to be liked, but not everybody will like me, and that isn't the end of the world." The theory behind this type of homework and similar assignments is that clients often create a negative, self-fulfilling prophecy and actually fail because they told themselves in advance that they would. Clients gradually learn to deal with anxiety and challenge basic irrational thinking. They read REBT self-help books. There you go, Mr. Ellis, with all your books. They listen to and criticize tapes of their own therapy sessions. Making changes is hard work, and doing work outside the sessions is of real value in revising clients' thinking, feeling, and behaving. REBT contends that imprecise language is one of the causes of distorted thinking processes. Clients learn that musts, oughts, and shoulds can be replaced by preferences. Instead of saying, "I would be absolutely awful," they can learn to say, "It would be inconvenient if." Clients who use language patterns that reflect helplessness and self-condemnation can learn to employ new self-statements. They can assume personal power by replacing their shoulds and musts with non-absolute preferences. Through the process of changing language patterns and making new self-statements, clients come to think and behave differently. As a consequence, they also begin to behave differently. REBT contends that emotional disturbances often result from taking oneself too seriously and losing one's sense of perspective and humor over the events of life. Counselors employ humor to counterattack the over-serious sides of individuals and to assist them in disputing their self-stimulating philosophy of life. Humor shows the absurdity of certain ideas that clients steadfastly maintain, and it can be of value in helping clients take themselves much less seriously. REBT practitioners use a variety of emotive procedures to teach the value of unconditional acceptance. They use such procedures as unconditional acceptance, rational emotive role-playing, modeling, rational emotive imagery, shame attacking exercises. Their purpose is not simply to provide a cathartic experience, but to help clients change some of their thoughts, emotions, and behaviors. And the reason I put this picture, they're modeling. They look like a bunch of automatons, don't they? Rational emotive imagery is a form of intense mental practice designed to establish new emotional patterns. Clients imagine themselves thinking, feeling, and behaving exactly the way they would like to think, feel, and behave in real life. They can also be shown how to imagine one of the worst things that can happen to them and how to feel inappropriately upset about this situation, how to intensely experience their feelings, and then how to change the experience to an appropriate feeling. Once clients are able to change their feelings to appropriate ones, they stand a better chance of changing their behavior in the situation. Such an imagery practiced several times a week will desensitize the individual to the strong feelings of such an event. There are both emotional and behavioral components in role playing. The therapist often interrupts to show clients what they are telling themselves to create their disturbances and what they can do to change their inappropriate feelings to appropriate ones. Clients can rehearse certain behaviors to bring out what they feel in a situation. The focus is on working through the underlying irrational beliefs that are related to unpleasant feelings. Lizette keeps putting off applying to a graduate school because she fears that she will not be accepted. Just the thought of not being accepted at her school of choice brings out feelings of being stupid. She role plays an interview with the dean of graduate students, notes her anxiety and the irrational beliefs leading to it, and the challenges the irrational beliefs that so absolutely must be accepted, and that not gaining such acceptance means that she is stupid and incompetent person. REBT practitioners use exercises that help people reduce irrational shame over behaving in certain ways. The main point of these exercises is for clients to work to feel unashamed even when others clearly disapprove of them. Clients normally accept a homework assignment to, to take the risk of doing something that they are ordinarily afraid to do because of what others might think. Minor infractions of social convention often serves as useful catalysts. By carrying out such assignments, clients are likely to discover that other people are not really that interested in their behavior. They work on these exercises until they realize that their feelings of shame are self-created and until they are able to behave in less inhibited ways. Clients can use force and energy as a way to go into intellectual to emotional insights. Clients are also shown how to conduct forceful dialogues with themselves in which they express irrational beliefs and then powerfully dispute them. Sometimes the therapist will engage in reverse role playing by strongly clinging to the client's self-defeating philosophy. The client is asked to vigorously debate with the therapist in an attempt to persuade him or her to give up their dysfunctional ideas. Force and vigor are a basic part of shame attacking exercises. Using Ellis's premise, Aaron Beck developed a therapy technique known as cognitive therapy. Similarities between the two include they're both active therapies, they're both directive, they're both time limited, they're both present centered, and they both use structured approaches. Beck considers his therapy insight focused in that it emphasizes recognizing and changing negative thoughts and maladaptive beliefs. Beck feels that people behave and feel the way that they do because of the way that they perceive and structure their experience. Beck's basic assumptions are people's internal communication is accessible to introspection. Clients' beliefs have highly personal meanings. These meanings can be discovered by the client rather than being taught or interpreted by the therapist. Beck feels that it is possible to understand the nature of an emotional episode or disturbance by focusing on the cognitive content of an individual's reaction to the upsetting event or stream of thoughts. By identifying automatic thoughts used by the individual, it may be possible to introduce schema restructuring. Beck contends that by inducing clients to recognize and weigh the evidence in support of their beliefs, the client and therapist can challenge the maladaptive beliefs. Beck has used this type of therapy to successfully treat depression, anxiety disorders, phobias, psychosomatic disorders, eating disorders, anger, panic disorders, substance abuse, and chronic pain. Beck feels that people with emotional difficulties tend to commit characteristic logic errors that tilt objective reality in the direction of self-deprecation. Psychological problems come from normal processes such as faulty thinking, making incorrect inferences in the basis of inadequate or incorrect information, failing to distinguish fantasy and reality. Arbitrary inferences, making conclusions without supporting and relevant evidence. This includes thinking of worst possible scenario and outcomes for most situations. Selective abstraction, forming conclusions based on an isolated detail of an event. In this process, other information is ignored and the significance of total context is missed. The assumption is that the events that matter are those dealing with failure and deprivation. Marie has anxiety disorder. When her son came home with a notice that the school was going to have scoliosis checks, Mary was suddenly struck with the idea that scoliosis must be so epidemic in the area that medical professionals were using this method to inspect all the poor cripples, so as not to alarm the less sensitive parents. For days she dreaded the phone call that would tell her that her son was a hopeless hunchback. When the form letter finally arrived, telling her that her son had a curvature of less than 5% and that this was normal, Marie saw that the 5% and went into a dither. She got her protractor and calculated that by age 20, he would be a hopeless cripple with the nickname of Igor. Overgeneralization is a process of holding extreme beliefs on the basis of a single incident and applying them inappropriately to dissimilar events or settings. Overgeneralizations. Magnification and minimization, perceiving a case or situation in a greater or lesser light than it truly deserves. Jocko was an East Coast PhD in anthropology with a concentration in Native American studies. He has visited 3 reservations and 1 tribal land in different parts of the country and has decided that since there were similarities between these 4 groups, all Native Americans must be the same. Since most of his knowledge comes from First Encounter Chronicles and in-depth anthropologic studies by missionaries, Indian agents, and 19th century anthropologists, he is using these accounts to support his own hypothesis. All American Indians are the same. Personalization, the tendency for individuals to relate external events to themselves, even when there is no basis for making connections. Labeling and mislabeling, portraying one's identity on the basis of imperfections and mistakes, made the past and allowing them to define one's true identity. Polarized thinking, thinking and interpreting in all or nothing terms, or categorizing experiences in either or extremes. Hi, Jack. With such dichotomous thinking, events are labeled in black and white terms. Petula is a new instructor. When 3 people dropped her class after the first session, she was convinced that her instruction was all wrong and tried to find a new way to get to students. She began thinking of herself as the bogus instructor who drives students away. Petula decided that every student had to think of her as the best instructor in the school, or she was doing a poor job. She now works at Burger King, where she is the best dang fry cook in 3 states. Beck feels that the most direct way to change dysfunctional emotions and behaviors is to modify inaccurate and dysfunctional thinking. It is the therapist's job as a cognitive therapist to teach the client to identify these distorted and dysfunctional cognitions through a process of evaluation. Clients must learn to discriminate between their own thoughts and events that occur in reality. Clients learn that their cognitions influence their feelings and behaviors as well as the way that they perceive environmental events. Thus, clients are taught to recognize, observe, and monitor their own thoughts and assumptions, especially their negative automatic thoughts. At this point, the client is challenged to test their negative automatic thoughts through Socratic dialogue with the therapist, carrying out homework assignments, gathering data on the assumptions that they make, keeping a record of activities, and forming alternative interpretations. Through a process of guided discovery, clients acquire insight about the connections between their thinking and the way that they feel and act. Cognitive therapy is focused on current problems. With this present-centered focus, cognitive therapy tends to be brief. The therapy goals include providing symptom relief, assisting clients in resolving their most pressing problems, and teaching clients relapse prevention therapy strategies. REBT is often highly directive, persuasive, and confrontive, and focuses on the teaching role of the therapist. In contrast, Beck uses a Socratic dialogue by posing open-ended questions to clients with the aim of getting clients to reflect on personal issues and arrive at their own conclusions. CBT therapists emphasize the client discovering their own misconceptions for themselves. REBT applies more structure and less self-discovery. The REBT therapist will tell the client that they are maintaining irrational beliefs and convince them through a process of rational disputation. Beck sees telling a patient that they are thinking irrationally because clients see their thought processes as reality. Beck identifies Ellis's irrational thoughts as ideas that are too absolute, broad, and extreme. Beck emphasizes that the quality of the therapeutic relationship is basic to the application of cognitive therapy. A successful therapist will display genuine warmth, accurate empathy, non-judgmental acceptance, the ability to establish trust and rapport with the clients. Beck sees the client-centered therapist as displaying the right idea but not taking it far enough. Beck's therapist must also have a cognitive conceptualization of cases, be creative and active, be able to engage clients through a process of Socratic questioning, be knowledgeable and skilled in the use of cognitive and behavioral strategies aimed at guiding clients to significant self-discoveries that will lead to change. Cognitive therapists encourage clients to take an active role in the therapy process. Clients are expected to bring up topics to explore, identify the distortions in their thinking, summarize important points in the session, collaboratively devise homework assignments that they agree to carry out. Beck conceptualizes a partnership between client and therapist to devise meaningful evaluations of the client's negative assumptions as opposed to the therapist directly suggesting alternative cognitions. The assumption is that lasting changes in the client's thinking and behavior will be most likely to occur with the client's initiative, understanding, awareness, and effort. Cognitive therapists aim to teach clients how to be their own therapist. A therapist will educate clients about the nature and course of their problem, the process of cognitive therapy, how thoughts influence their emotions and behaviors. The educative process includes providing clients with information about their presenting problems and about relapse prevention. Homework tailored to the client's specific problem and arises out of the collaborative effort of the therapist and client. The purpose of homework in cognitive therapy is not only to teach the client new skills, but to enable them to test their beliefs in daily life situations. Emphasis is placed on self-help assignments that serve as a continuation of issues addressed in therapy sessions. Bibliotherapy, clients are asked to complete readings dealing with the philosophy of cognitive therapy. These readings are assigned as an adjunct to the therapy and are designed to enhance the therapeutic process by providing an educational focus. Some likely titles include Love is Never Enough by Beck, Feeling Good by Burns, The Feeling Good Handbook by Burns, Own Your Own Life by Emery, Woulda, Shoulda, Coulda by Freeman and DeWolf, Choosing Life by Ellis and Newman. Cognitive therapy initially gained recognition as an approach to treating depression, but extensive research has been devoted to the study and treatment of anxiety disorders. Cognitive behavioral methods have been applied to children and families, parent training, child abusers, marital distress, divorce counseling, skill training, stress management, and healthcare problems. Beck was initially a psychotherapist. He challenged Freud's idea that depression results from anger turned inward. Instead, Beck focuses on the content of the depressive's negative thinking and biased interpretation of events. Beck has even identified cognitive errors in dream content of depressed clients. Depression, Beck identifies a cognitive triad as a pattern that triggers depression. The first component of the triad is that clients hold a negative view of themselves. They blame their setbacks on personal inadequacies without considering circumstantial explanations. They are convinced that they lack the qualities essential to bring them happiness. The second component of the triad consists of the tendency to interpret experiences in a negative manner. It almost seems as if depressed people select certain facts that conform to their negative conclusions, selective abstraction. The third component of the triad pertains to depressed clients' gloomy vision and projections about the future. They expect their present difficulties to continue, and they anticipate only failure in the future. Depression-prone people often set rigid perfectionistic goals for themselves that are impossible to attain. Their negative expectations are so strong that if they experience success in specific tasks, they anticipate failure the next time. They screen out successful experiences that are not consistent with their negative self-concept. The thought content of depressed individuals centers on a sense of irreversible loss, which results in emotional states of sadness, disappointment, and apathy. Beck designed a standardized device to assess the depth of depression called the Beck Depression Inventory. The items are based on observations of the symptoms and basic beliefs of depressed people. And there you go. Sadness, pessimism, sense of failure, lack of satisfaction, guilt feelings, sense of punishment, self-dislike, self-accusations, suicidal wishes, crying spells, irritability, social withdrawal, indecisiveness, distortion of body image, work inhibition, sleep disturbances, fatigability, loss of appetite, weight loss, somatic preoccupation, loss of libido. Beck's therapeutic approach focuses on specific problem areas and the reasons clients give for their symptoms. Some of the behavioral symptoms of depression are inactivity, withdrawal, and avoidance. Clients may report that they are too tired to do anything, that they feel even worse if they become active, and that they will fail at anything they try. The therapist may probe with Socratic questioning. What would be lost by trying? Will you feel worse if you are passive? How do you know that it is pointless to try? Beck's therapeutic approach focuses on specific problem areas and the reasons clients give for their symptoms. Some of the behavioral symptoms of depression are inactive. Oh, I've already done that. The therapist and client may set up an activity schedule with graded tasks to be completed. Clients may be asked to complete easy tasks first, so they will meet with some success and become slightly optimistic. The point is to enlist the client's cooperation with the therapist on the assumption that doing something is more likely to lead to feeling better than doing nothing. Some depressed clients may harbor suicidal wishes. Cognitive therapy strategies may include exposing the client's ambivalence, generating alternatives, reducing problems to manageable proportions. The therapist may have the client list the reasons for living and for dying. If the client can develop alternative views of a problem, then alternative courses of action can be developed. This can result in the client feeling better and behaving in more effective ways. A central characteristic of most depressive people is self-criticism. Underneath the person's self-hate are attitudes of weakness, inadequacy, and lack of responsibility. Clients can be asked to identify and provide reasons for their excessive self-critical behavior. The therapist might ask the client, "If I were to make a mistake the way that you do, would you despise me as much as you do yourself?" A therapist may play the role of the depressed client, portraying the client as inadequate, inept, and weak. This technique can be effective in demonstrating the client's cognitive distortions and arbitrary inferences. The therapist can discuss how the tyranny of shoulds can lead to self-hate and depression. Depressed clients typically experience painful emotions. They may say that they cannot stand the pain or that nothing can make them feel better. One procedure to counteract painful affect is humor. A therapist can demonstrate the ironic aspects of a situation. If clients can even briefly experience some lightheartedness, it can serve as an antidote to their sadness. Such a shift in their cognitive set is simply not compatible with their self-critical attitude. Another specific characteristic of depressed people is an exaggeration of external demands, problems, and pressures. Such people often exclaim that they feel overwhelmed and that there is so much to accomplish that they can never do it. A cognitive therapist might ask clients to list things that need to be done, set priorities, and check off tasks that have been accomplished, and break down an external problem in manageable units. When problems are discussed, clients often become aware of how they are magnifying the importance of these difficulties. Through rational exploration, clients are able to regain a perspective on defining and accomplishing tasks. The therapist usually must take the lead in helping clients make a list of their responsibilities, set priorities, and develop a realistic plan of action. Because carrying out such a plan is often inhibited by self-defeating thoughts, it is well for the therapist to use cognitive rehearsal techniques in both identifying and changing negative thoughts. If clients can learn to combat their self-doubts in the therapy session, they may be able to apply their newly acquired cognitive and behavioral skills in real-life situations. Donald Meichenbaum has developed a cognitive therapy that focuses on changing the client's self-verbalizations. Meichenbaum feels that self-statements affect a person's behavior in a similar manner that words from another individual might affect the client. Thus, an individual must notice how they feel, think, and behave. For example, for change to occur, clients need to interpret the scripted nature of their behavior so that they can evaluate their behavior in various situations. Meichenbaum focuses on dealing with the interaction of three processes: inner speech, cognitive structures, and behaviors. This he does in three phases. Phase 1, self observation. Clients learn to observe their own behavior. When they begin therapy, their internal dialogue is full of negative self statements and imagery. The therapist must convince them to listen to themselves and develop a sensitivity to their thoughts. They must recognize that they are not victims but initiators of the negative thoughts and feelings. Clients must acquire new cognitive structures that enables them to view their problems in a new light. Starting a new internal dialogue as a result of the early client-therapist contacts, clients learn to notice their maladaptive behaviors and they begin to see opportunities for adaptive behavioral alternatives. Clients must begin a new dialogue with themselves that initiates a new behavioral chain, one that is incompatible with their maladaptive behaviors. Therapy allows them to change their internal dialogue, and the new internal dialogue serves as a guide to new behavior. In turn, the new behavior impacts their cognitive structures. Phase 3, learning new skills. The third phase consists of teaching clients more effective coping skills. These will be practiced in real-life situations. At the same time, clients continue to focus on telling themselves new sentences and observing and assessing the outcomes. As they behave differently in situations, they typically get different reactions from others. The stability of what they learn is greatly influenced by what they say to themselves about their newly acquired behavior and its consequences. Coping skills programs. The rationale for coping skills programs is that we can acquire more effective strategies in dealing with stressful situations by learning how to modify our cognitive set. Exposing clients to anxiety-provoking situations by means of role-playing and imagery, requiring clients to evaluate their anxiety levels, teaching clients to become aware of the anxiety-provoking cognitions they experience in stressful situations, helping clients examine these thoughts by reevaluating their self-statements, having clients note the level of anxiety following this reevaluation. Teaching coping skills, stress inoculation. Individuals are given opportunities to deal with relatively mild stress stimuli in successful ways so that they gradually develop a tolerance for stronger stimuli. Stress inoculation takes place in three phases: the conceptual phase, skills acquisition and rehearsal phase, the application and follow-through phase. Stress inoculation, the conceptual phase, creating a working relationship with the client. Together, they rethink the nature of the problem, teaching the client that they are most often the authors of their own stress. The skills acquisition and rehearsal phase, clients gather information about their fears, learn which situations bring about stress, arrange to lessen the stress by doing something different, learn methods of physical and psychological relaxation. Stress inoculation, application and follow-through phase, transferring what has been learned in therapy to the real world. The client is given homework on which they must follow through. The homework is checked for follow-through in subsequent meetings. Stan and CBT. Stan has several self-defeating beliefs. He must be strong and perfect. He can't show weakness. He must be loved. Women rejecting him makes him nothing. Failing makes him a failed person. He feels inferior, therefore he must apologize for his existence. The therapist helps him discover these automatic thoughts he is using to keep himself down. The therapist helps Stan monitor and evaluate how his self-dialogue helps maintain these self-defeating thoughts. The therapist helps him clarify specific problems. He is not his father and he is not like him. Why is he focusing on his parents' negative assessment of him? Why does he see himself as a failure when current evidence doesn't support it? Stan is his own worst critic. After the therapist points out Stan's errors in logic, he uses Socratic questioning, guided discovery, and other cognitive restructuring to attack his mistaken core beliefs. The therapist has Stan use guided discovery to evaluate his mistaken beliefs and conclusions. Stan begins to evaluate his behavioral choices against his core beliefs, and as his understanding changes, so does his behavior. The therapist gives Stan homework assignments that reprogram his core beliefs and gives him new coping skills. Stan's new coping skills are put into practice with additional homework that addresses his fear of women and rejection. And that is finally it. Okay, next week we will tackle reality therapy.